According to the Centers for Disease Control, African Americans are 10% more likely to develop cancer than their white counterpart. Minority racial groups are more likely to experience multidimensional poverty than their white counterparts. And African Americans and Latinos are more likely to attend high poverty schools than Asian Americans and Caucasians. Why do you think that is? Possible factors could include lifestyle behaviors, socioeconomic status, and education. But the most important and underlying factor is racism. My name is Deandra No, and I am a proud alumna of Howard University. Currently, I am a master's candidate in public health at Baylor University. Today, I am here, colleagues, to discuss racism, a public health crisis. Racism, structural bias, and social inequities are known as important social determinants of health. Social determinants of health are factors surrounding the social, economic, cultural, and environmental conditions that can affect a person's well-being and quality of life. Social determinants have a great impact on inequity. Racism can create challenges for marginalized communities, health, and quality of life outcomes. Bias in any way or form can provide challenges for any individual. Individuals who experience bias can have a lower quality of life due to specific factors and conditions. There has been documented evidence that bias is evident throughout healthcare. For instance, Black mothers have higher mortality rates during childbirth than their white counterparts. This type of bias can develop mistrust among Black women and health providers. Moreover, social inequities, such as socioeconomic status, is a prominent characteristic. Large disparities exist between people from low and high socioeconomic groups. For instance, life expectancy is strongly related to income levels. Individuals with higher incomes usually have access to better healthcare. The social environment contributes to a regulation of psychosocial influences on health. All the determinants interact with each other to produce health. Individuals with higher health status inequities have a low distribution of health and well-being. Health disparities are complex issues compiled of various factors that are rooted in racism and discrimination. To understand how to provide solutions to the various social and economic inequities that produce health disparities, it is important to evaluate how health systems and policies are designed to reduce health disparities. Challenges that plague health disparities can include food, neighborhood, physical environment, and the healthcare system. Bringing awareness to communities that have these challenges are pivotal. Facilitating conversations on how communities obtain access to healthy food options, learning how a city's infrastructure can affect its citizens, and understanding how to improve the quality of care for uninsured populations can aid in reform. Learning how to combat these long-standing challenges that plague marginalized populations are important for community advocacy. Addressing, highlight, and eliminating health insecurities experienced by under-resourced communities of color is important to promote population health and equity through organized, evidence-based programming of all while strengthening individuals' faith in their community's access to positive health outcomes. Reformation of public policy at the local, state, and national level can produce public health initiatives that rewrite the standards and systems that have been traditionally disadvantaged the health of indigenous communities. The notion to highlight and to eliminate healthcare insecurities displayed in under-resourced communities for people that resemble me and promote population health and equity through organized, evidence-based programs is needed. Providing support to underserved communities by helping reform public policy at a national level by providing guidance and framework for public health initiatives is also necessary. This allows for resetting standards and systems that will produce the opportunity for individuals to succeed. As a budding health practitioner, I urge you to join me in holding legislation accountable. Join me in adjusting factors that influence health outcomes, and join me in transforming systems that shape the conditions of daily life for all. And with this, I bid you adieu and happy American Public Health Week.